Hello, everyone. A lovely post-lunch audience. Yeah. Uh, so I've got this opportunity to uh, host Mr. Harish Gudi, who is, I think, hired some brilliant talent at Optum while he is heading engineering and technology throughout. And given India has been, I mean, it's no prize for guessing that it is continuing to be the talent hub for various global companies. And tech in health being one of the most important elements when it comes to growth that we are seeing rapidly, whether it is in across the globe businesses, plus in the technology talent need that is growing in India as well. And looking at Optum having its rapid growth in India, tech, being a India tech hub itself, right? So I think no better than Mr. Harish can give us, throw some light in terms of what are the elements of growth there, what are the interesting elements, how technology talent needs to look at and learn from for it, for the talent pool to kind of consider and focus their own growth in this space. So out of this, I have a couple of questions that I've put together in this space. So healthcare tech sector is rapidly growing, right? And from your experience, Harish, if you could throw some light, what are the key factors of this growth from your experience and from your insights?
Thank you, Vani. And first, it was great talking to you off stage as well and spending all that time. Thank you, Nasscom, for the opportunity. I think it's great. To Vani's question here, I think there is no doubt that we're going to have very rapid growth in the healthcare space. I'm seeing, or we are seeing, two or three main areas. Overall, I think in healthcare, everybody is looking at how do we make sure that consumer is in the center of the business. And that is going to drive a lot of change. How do we give common experience, uniform experience across various journeys that the consumer goes through? And huge growth in this space because of multiple channels that are emerging that we'll talk about. The second thing definitely is a lot of focus on health, wellness, and preventive medicine, right? So that is getting a lot of focus. And we are looking at IoT, wearables, data, and to look at all of that to see how to make healthcare lives and systems work better for all of us. Last but not the least, when you talk about customer and consumer as the center, and when you have large organizations that span across multiple journeys, bringing all these platforms together in a seamless operation manner is becoming the talk of town and the most important thing. And how do we take care of inter-platform interoperability, not just within the organization, across various things like insurance and healthcare and service and claim adjudication, and follow it up with prescription and post-admission care, so all that spectrum, how do you bring together internally? Also, there are multiple care entities, insurance entities that you have to all bring together. So interoperability is becoming much, much bigger to give better consumer experience, not just platforms internally to the organization, but how do we take care of it across multiple organizations in the ecosystem? These are the three areas I think where we're seeing huge and rapid growth in this space.
This is very interesting, right? Especially on the healthcare preventive post, sickness care. It gives us a good segue in terms of, asking several questions that come in our minds, especially in the technology professionals. When technology professionals are talking about getting into healthcare or continuing in the healthcare as a space for themselves, telemedicine comes immediately as a next thought, right? So, and looking at the growth, looking at the need, at that pandemic actually triggered this rapid growth. It became very disproportional when it comes to the need for that growth, and also it became almost a second thought the moment when we, talk about health. So, how should actually the tech professionals be considering the challenges, or what challenges they should be thinking about when it comes to this kind of growth, this kind of trend picking up in the telemedicine? So,
Fair enough. See, telemedicine, while it accelerated during COVID, it was a phenomenon that had already started picking up a lot of ground. Well, if you do read some of the analyst reports and all, you will know that at the peak, it was about 38 times of what it was before COVID. It settled down, become realistic, but remember, it's still a lot higher than what it used to be as a go-to thing. Telemedicine is one channel. Again, and when you think channel, think consumer. So it brings out a lot of advantage and a lot of complexities as well that you have to take care as part of the technology element that you have to build in and around that. Also remember, telemedicine helps in better reach, early reach, and better prevention as well. We are also seeing a lot of pickup through telemedicine on mental health because there's a lot more awareness that is coming on mental health. When you have telemedicine as a channel, how do you again make sure from a tech perspective you integrate the experience that the consumer has across the value chain, right? Because now you're bringing one more element or channel into the entire ecosystem. And consumers will move from telemedicine to in-hospital to other channels. And how do you still continue to give them that seamless experience? This is a big challenge that we have to talk through. The other big advantage it is obviously bringing to the table is wearables and IoT and devices that we can track and be able to do virtual care. It also helps with proximity. People who are not able to reach hospitals fast, people who are far off, remote, smaller towns and villages are able to access healthcare faster. When you access healthcare faster, you intervene earlier. You do better wellness, you do better preventiveness. And that makes healthier lives. I think that's the whole ecosystem that we have to work on.
this is interesting, right? Like, people across the globe will be, reaching out to the healthcare professionals, the doctors, who will advise them on some cure and certain preventive advices, and you will meet the doctors like this. Whereas the whole world pre-pandemic is aware of like doctor checking the pulse. Your pulse is read by the machines, and the machines reports are thrown to the doctor who is sitting in the screen, probably in some other country in the globe, in different continent altogether. So looking at all of this complexities that it will involve, it just throws the next question, Harish. There are multiple, when it comes to health, the immediate complexity is the combination of the domain expertise and the regulatory aspects of it. There are so many regulations, there are so many complexities when it comes to health, different geographies. And looking at just US, if at all you want to focus on in terms of the regulations there, and India talent, there are across the globe talent wanting to understand the domain expertise or get entrenched into the domain expertise plus the regulation limitations there, right? It opens up the next set of questions as to how actually tech professionals will need to be now balanced in terms of having the combination of all of this, and then ensuring, when you said customer being the center of all of this, which means there is no room for error in this whole space. There is zero error. This is a zero error domain. So how would you actually help us throw some light in terms of this challenge?
It's a very fun statement you made that it's a zero error, right? Yeah, it's zero error. Quality first. You got to get it first time right. You cannot do surgeries in iterations and figure it out, right? Absolutely. So you have to get it first time right, which also means huge focus on domain. And look, domain is not just important for healthcare. It is important for every industry. But like you said, in healthcare, it gets complex. We think of healthcare as medical professionals and nurses, but think about the entire spectrum. There is insurances, there is claims, there is adjudication, there is pre-care, there is post-care, there is preventive, there is wellness, there is prescription, there is house call, there is follow-up. All of that has to come together. So, and think of other ancillary things that we don't even hear of. There is revenue management, there is life cycle management, right? you have to think about all these things from a domain perspective. At Optum, we have one big advantage. We work across the spectrum, and what we've been able to do well is a lot of training programs. As a culture, the enterprise is integrated into training. The changes and fast moving and rapid changes are not just in governance and rules and regulations, but even physicians, the procedures, the medications, the new inventions are changing very rapidly, and you have to be abreast of that all the time. The good thing is, look, we work with 9 out of the Fortune 500 customers. We work with 9 out of every 10 hospitals in the US. We work with 4 out of every 5 plants. We are in the ecosystem where we work with 113 life sciences organizations. We work in 40 states. We cover DC. We also cover Medicare, Medicaid, military, right? And the whole works. This gives us, and since we've been in this space for a long time, we have a lot of experts who have a view into this. Additionally, we build experts by making sure people get exposure. We have a mobility program, we have a rotation program where you get to see each part. Because only with that over time, you will become the healthcare system innovator of the future, right? And not to take away the importance of continuous training, upgrading it, anytime, anywhere, bite-sized, on the go, continuously updated, AR, VR, gamification, everything is on the table to make this happen. Because remember what you started with. You can't get it wrong and you can't iterate. You got to get it right the first time. So
that actually gives a good segue into the next one, right? So especially for the newer talent to enter into that, the non-sector talent to enter into that. With this kind of a innovation in technology, with the modern tech that it needs to now involve, you're talking about AR, VR across the range, right? Like the preventive, post-surgery care, and the continuity of a good health care, right? So it just opens up another good question as to there is a huge gap when it comes to skill, right? Well, for the new talent pool to enter into this particular thing. How would you address all of that with respect to so much of technology innovations happening? A skill gap, how would you arrange?
From a domain perspective, we talked about it, but I also want to tell people that yes, every industry is complicated, and there is enough from other industries that apply to healthcare, right? Consumer, there's a lot to learn from the consumer industry, the retail industry, if you want to start thinking about healthcare customers or consumers. So bring that knowledge to the table, learn through what we talked about. From a tech perspective, there are 3 or 4 things that I think are important, are big things that are going on. Number one is cloud. 83% of healthcare tech is on cloud. Cloud brings its own advantages and a lot of work in and around that. There is migration, there is modernization, there is cost management, there is security, So people who can work through this, design systems that are robust, first time right, can't have it down for even a second, right? So that is a big space. Second big space is, as we talk about consumer, how do we bring together the data that we have to understand the trends and create the right insights to be able to serve that consumer better, right? That becomes key. Now there is a tech part to it, there is a domain part to it, and there's a storytelling part to it, right? How do you take tech, your understanding of domain, and be able to tell the story of what's going on out there? If you tell the story right, you'll be able to fix it. Then there are tools like Python, SAS, analytics, enough reporting tools out there, Power BI, Tableau. I think these are all, base of the game. I think all that obviously needs to come to the table. 2 more things if I were to think about. Let's talk a little bit adjunct tech, okay? Healthcare economics, healthcare informatics, medical coding, really picking up in this country and all over the world. If you do not get your data input right throughout the stream, patient admission, integration, insurance, what disease he has, and then there is all this coding, right? Because there are standards. Everything has to be converted into a code. An admission, a procedure, a diagnosis, the instrument that was used, how was the incision made, assuming it's surgery. Everything has to be coded. If you don't get that coding right, you don't get anything downstream. Right? Think of it as kind of master data, right? But that needs a little more knowledge and understanding and qualification in terms of understanding medical terminologies, processes, codings. There are certifications available out there in the industry, which I would think are great careers to be had in India, and not just in India, but all over the world. Last but not the least, what did we start with? We started with consumer experience. If consumer experience is going to be king, UI, UX, we all know, we all talk about it. User experience design, journey design, zero distance. How do you get closer to the end user and not sit in your office room somewhere and write code, right? How do you get close to the nurse, the practitioner, the emergency ambulance driver, right? The emergency room. Post care, the people who go to visit hospitals for old patients. You have to get close to them, zero distance, and be able to work through that entire model. I think these are 3 or 4 things that are going to be very, very important from a tech perspective.
To follow up with that, what are the initiatives, if you could name some at Optum maybe to kind of bridge this gap? Any of the initiatives or collaborations that you would have done for the talent?
Yeah, so we did talk about the training platforms and enterprise platforms that we have. But from an initiating perspective, we talked about line of business, we talked about innovation. You know, Nitya sitting over here runs an entire Elevate program where ground up ideas are collated, hundreds and thousands of ideas. How do we filter? How do we optimize, right? There is a huge initiative called Sit with Ops. I want every tech person to sit down with operations, what I called about zero distance. These are the initiatives that are running to make sure that we touch the lives of people, help them lead a healthier life, and make the healthcare system better.
Yeah, awesome. I think this actually segues into the conclusion session. The right point that you brought as to the technology needs to marry even at a talent level on a day-to-day basis, how the operations actually carried out, right? So, and leaving that for the question as to what advice does it, can the audience or can the tech professionals carry home when it comes to playing their role, their bit in the world of technology for the healthcare sector? For that matter.
I was just checking out the Nasscom 2023 strategy report on India. 5.4 million technologies, right? Innovation will happen from here, can happen from here, not just for India, for the world. Remember that, number one. Number two, there is a philosophical discussion as well. And I personally believe that there are good careers and there are great careers, and tech is a good career. There is no doubt. Anything in tech is a good career today, right? But the great careers are where you can marry tech with passion, with giving back to society and doing something better in your life. Frankly, if I look at the young tech generations that we're looking at and hiring today, sense of purpose is higher. I was not like that when I was 22, 23, 24 years old. I actually believe the youngsters today have higher sense of purpose. Well, what is a better place to have all this tech and work on making people's lives healthier, right? I think this is a place and an industry, Optum and in general the healthcare industry, is a place you can do your life's best work, is what I sincerely believe in the sector.
I think this is a great point, especially, and I second that, Harish, the talent of today and the talent of tomorrow constantly thinks about work with purpose.
Absolutely.
Right? So their work is so much associated with the purpose, whether it is a creative space or whether it is the health, preventive health, even the well-being or the psychological well-being for that matter, and the preventive and the cure part of health. So people, it's gone are the days when health was only associated with doctors as professionals. Right? So those days are gone. So they're far behind. And I have a 21-year-old at home and my daughter, and constantly, and she is a psychology student. And like, why did you pick that? It's constantly for, hey, I want to really help people by ensuring that they do not take the problems the way today's world deal or yesterday's world deal with it, right? So I think that's the tomorrow that we we see in our own children and the youngsters at home or in our families, the way, and the tech professionals also for that matter, or the wannabe tech professionals also. So working by having the purpose associated with the work is, I think that it's not only the trend, that it is going to be actually the way of life for people. I think you left us with a very good note on those elements of, have technology and the healthcare as a sector associated with your career by, amalgamation of the purpose and your professional growth, right? So thanks for that. And definitely great insights in terms of how Optum is also looking at and how you are looking at building your team with purpose, right? So amazing. Thanks.
Thank you. I really look at it as a privilege that I am able to be in this industry and service humanity in general. There's an Optum booth outside. If you want to just catch up, chat up, meet me out there. Thank you very much.